In this video, we are going to break down Diastasis Recti with 5 points and providing actionable solutions. Number 1. What is Diastasis Recti? DR refers to the separation of the abdominal muscles, specifically the rectus abdominis, which is the muscle that runs vertically down the center of your abdomen. During pregnancy, hormonal changes and the growing uterus put pressure on the abdominal wall, leading to this muscle separation. While it's common during and after pregnancy, it can also occur in non-pregnant women, men, or people who experience significant weight gain or strain. DR can leave the belly feeling loose and make it harder to regain strength and shape in the core. So, what can you do about it? To address DR, it's important to avoid exercises that put excessive pressure on the abdominal area, like crunches or sit-ups, etc. Instead, focus on gentle core strengthening exercises such as pelvic tilts and diaphragmatic breathing, which help engage the deep abdominal muscles and promote the healing. A physical therapist specializing in postpartum care can guide you through exercises tailored to close the gap safely. Number 2. Causes and risk factors. Primary cause of DR is pregnancy, especially during the 3rd trimester, when the growing baby puts pressure on the abdominal wall. However, other risk factors include multiple pregnancies, having a larger baby, or being over the age of 35. Additionally, lifestyle factors like excessive abdominal pressure from heavy lifting, poor posture, or intense abdominal exercises can contribute to this condition. Even men can develop DR due to obesity or improper exercise techniques. So, what do we do about it? If you're pregnant, try to maintain a good posture and avoid heavy lifting to reduce the unnecessary strain on your abdominal muscles. After pregnancy, avoid any abdominal exercises that causes bulging in your belly, such as the traditional sit-ups, etc. Instead, work on pelvic floor exercises and engage in gentle core strengthening under the guidance of a proper professional. Number 3. Signs and symptoms of DR. Some signs that you might have for DR include a visible bulge or a gap in the middle of the abdomen, especially when you try to sit up from a lying position. You may also experience lower back pain, poor posture, or even a feeling of weakness in the core. In some cases, people feel that their abdominal muscles aren't functioning properly, which can make it harder to perform basic activities like lifting or bending. So, what do we do about this? The first step is to check for your gap in your abdominal muscles. Lie on your back with your knees bent and your feet flat on the floor. Place your fingers above your belly button and gently press while lifting your head and shoulders off the floor. If you can feel a gap of more than 2 finger widths, it's time to address your DR. You can consult a professional who can help with this. We also specialize in DR as a team. The importance of corrective exercise is the 4th point. Corrective exercise plays a key role in healing DR. The goal is to retrain your core muscles to engage properly, helping close the gap in your abdominal wall. Exercises that strengthen the deep core muscles like the transverse abdominis can help support the healing process. But it's important to approach this gently. Overdoing exercises like crunches can actually make your DR worse, increasing pressure on the abdominal muscles. So, what do you do about it? Focus on specific low-impact exercises like pelvic tilts, bridges, and modified planks. These exercises engage the deeper layers of your abdominal muscles without putting excessive strain on the separated muscles. Gradually progress to more challenging exercises as you build the strength. It's essential to work with a proper professional such as a pelvic floor therapist or a postpartum fitness expert. We are one such experts to make sure that you're doing the right exercise in the right way. Number 5. When to seek professional help. DR can often improve with exercise and self-care, but in some cases it might require a professional intervention. If the gap in your abdominal muscles is larger, that is greater than 2.5 to 3 fingers wide, and if you experience constant back pain or pelvic instability, or if your symptoms don't improve despite your efforts, it's time to see a specialist. In severe cases, surgery may be recommended to repair the separation. So, what do you think you should be doing about it? Consult a proper professional, a healthcare provider, if you're unsure about a condition or if you're struggling to make progress. A physical therapist specializing in DR can offer hands-on therapy, guide you through personalized exercise program, and help you track your progress. In rare cases, surgery might be an option if the gap is too large or causing functional problems. Surgery is typically reserved for only severe cases that haven't responded to the physical therapy in the first place. So this video provided a detailed explanation of DR from understanding the condition to practical solutions with a focus on empowering women to take control of your healing journey. Like this video and subscribe this channel for more such amazing mom fitness content.